Welcome to Peak Physical Therapy, and today we're going to be doing an exercise routine for the knees. This exercise routine is specifically for people who are about to go into surgery to get a total knee replacement. And the idea behind this is to get the knees stronger, get those muscles stronger, so then after the surgery, you're in a better position to get better and get back to your normal functionality in life. Now, if you go into surgery weak, you're going to come out even weaker. So that's why we want to get you strong now. So when they cut into those muscles and they kind of replace the knee, you come out, those muscles are going to be just a little bit stronger than if you didn't do anything, and you can move right along with your rehab. So these exercises are designed to do pretty much right now and right after surgery. You can do a lot of these exercises. Now, what you're going to need for this exercise routine is you're going to need a chair, you're going to need a towel, and then you're going to need some sort of strap or a belt, or if you have a long sheet, just something where you can put both hands and kind of provide a stretch, okay? So without further ado, we're going to get started. I am going to be taking you through the full routine, targeting both sides, just because you want to make sure, even if you're not having knee pain on the right, but you are on the left, right after surgery, this is going to be your good leg, or the other leg, vice versa. So we want to make sure that knee's moving well too. So, and then if you have both of your knees are bad, then hey, there you go. We're working on both. So, all right. The first one is going to be a towel extension stretch. So you're going to have a towel rolled up. Make sure it's fairly on the bigger side, just so the bottom of your knee is elevated. So we're going to get that stretch and have gravity pull that knee down. So put the towel at the end, prop your heel, and you're going to start the time. We're going to go for about a minute. First 15 seconds or so, you can just kind of sort of let your muscles relax. And then what we're going to do is we're going to be providing a little bit of overpressure just to give a better stretch so we can get that knee even straighter. So you can have both hands pushed kind of right below the kneecap and right above the kneecap. You shouldn't be torquing it down. Just a nice gentle stretch where you can breathe, where you feel the back of your thigh maybe stretching a little bit. We got 20 more seconds on this side. I strongly encourage you to do these exercises with me. I'm doing the right time, so if you go through, watch the whole video, there's your exercise routine. All right. And 2, 1. Perfect. Now we're going to do the other side. I'm just going to kind of relax the muscles first, and then I'll apply that overpressure. And why it's so important to get range of motion is you need this terminal extension, especially if you're going to have a good gait right after surgery. You want that terminal extension so you can get that nice heel-toe gait. All right, we're about 30 seconds in. If you can't reach up and push on both sides, you can just use the top thigh here and push. I don't know if you can see. All right, about 10 more seconds. And again, try to relax the muscles. Don't tense. Let the muscles just relax. You got 3, 2, 1. Perfect. Next, we're going to get the strap. You can use this as a pillow. All right. And what you're going to do is we'll do this side first. We'll do this side first. You're going to strap it kind of at the lower shin here. You're going to lie back. And what you're going to do is you're going to take both of the straps and you're going to pull, and you're going to basically try to touch the heel to the bottom here, okay? Now if you're over here and you're feeling a stretch, perfectly fine. Just kind of feel that gentle stretch. Don't over torque it to get it there. Just kind of nice gentle stretch where you feel it and you can hold it for a minute. Again, don't lift up your head or your neck like that. We don't want any neck or back pain, okay? Alright, so we're about 30 seconds in. If you're pretty flexible, you can kind of lift up the hip just a little bit, just to kind of pull a little bit more. Alright, 15 more seconds. Three, two, one. Now we're going to do the other side here. Alright. So again, this nice gentle stretch. You can incorporate some good breathing techniques. So in through the nose, out through the mouth. Don't hold your breath with any of these exercises. So you can smell those roses and then blow out the candles. All right, we got about 20 more seconds here on this side. All right, 5, 4, 3, 2, 1. All right. Now, when getting up, don't throw your back up like that, just because that's really bad for your back. Roll over to the side, push yourself up. You can get on your knees and pop up that way. Okay, we don't want that excessive rotation causing any low back pain. Next, we're going to be doing a calf stretch. We're going to be doing it at the wall. I'm going to be kind of facing behind you, but you're going to basically look like this with your back leg straight, hands or forearms on the wall. You're going to shift that pelvis forward, trying to keep that heel on the floor to get that stretch. So we're going to do that for about 30 seconds on each side. So here we go. And if you're on like a tile, make sure you have something sticky. Like I have a yoga mat where your foot's not going to slip and you're going to hurt yourself even more. So make sure your foot's nice and secure. You wear a shoe if you have to. All right. Feel that stretch kind of right there. You got 5 more seconds on this side. All right. You're going to switch legs. Shift that pelvis forward, keeping this leg straight. Feel the stretch right in the calf area. Mm. 10 more seconds. All right, perfect. Okay, so that's the first stretch. First stretching, we did the knee extension, we did the flexion, we did the calf. We're going to do that same routine at the very end, but now in the middle, we're going to be doing all our strengthening exercises. So the first one is going to be a straight leg raise. So this one's going to be on your back, and basically what you're going to do is you're going to have, let's do the right leg first here. Keep this leg straight, keep this one bent. And what you're going to do is just keeping the leg straight, raise it up and down. 2, 3. Really focus on that control on the way down. There's 4. Try to target the other knee. There's 5. There's 6. 7, there's 8, 9, 10. Really activate this quad. There's 11. We're going to do 15, 12, 13, 14, 15. Really nice and controlled down. All right, let's do the other side. 1. Try not to have that bend in the knee. Get it as straight as you can. There's 2, 3, 4, 5. Have that foot in neutral, so don't have it out like this or in. Have it nice and straight. 6, 7, 8, 9, 10, 11, 12, 13, 2 more, 14, and 15. Awesome job. All right, so now we're going to be rolling on our side. We're going to be doing a clamshell to target this glute med muscle right here. So what you're going to do, bring the knees up, lie your legs on top of each other, keeping the feet together. You're going to open up the knee. So 1, try not to rotate the back. Keep the back nice and steady. Go up as high as you can. Well, there's 2, there's 3, 4, 5, 6, 7, 8, 9, 10, 11. Really focus right here on this muscle. 12, 13, 14, 15. We're going to do 20. 16, 17, 18, 19, 20. Now, flip over to the other side or just roll to the other side. Now we're going to do another 20 here. 1, 2, 3, 4, 5. You can have your hand back here to help prevent that rotation. There's 6, 7, 8, 9, 10, halfway there, 11, 12, 13, 14, 15, 16, 17, 18, 1 more, or 2 more, 19, and 20. All right, you should be feeling it kind of right here in the side butt area. All right. Next, we're gonna use the towel again. We're gonna do a quad set. So rolling up the towel here, what you're gonna do is basically you're gonna activate this quad muscle and you're gonna try to push your knee down into the towel and squishing it. You're gonna hold for about 3 seconds. 1, 2, 3. Relax. 1, 2, 3. Really try to get that knee as hard down as possible. Now again, don't strain and hold your breath. Make sure you're breathing. Relax. Squeeze. There's 5. There's 6. There's 7. We're only going to do about 10 of these. 8. Now this isn't a true strengthening exercise. It's more of an isometric exercise, but it gets that muscle really focused on just kind of contracting, which you're going to need right after surgery. All right. Let's do the other side here. All right, there's 1. There's 2. Keep holding. Relax. There's 3. There's 4. There's 5. There's 6. Again, really try to focus on this muscle right here. There's 7. You're going to keep holding and breathe. There's 8. 2 more. You kind of see this one. This leg is kind of doing it as well, but really, you can just focus on this side. And last one. Awesome. All right. So that gets that knee moving, gets the extension of the knee kind of moving a little bit better. Next, we're going to be doing what we call long arc quads or leg kicks. We're going to be moving over to the chair here. All right. So sitting in, you can sit in really any chair. Ideally, it'd be a chair, not a recliner, just because you're not going to get the range of motion. Now, if that's the only chair you have, then go for it. It's better than not doing it. So very simple exercise, up and down, and try to really get your knee as far back as possible. So there's 1 on this side, 2, 3, there's 4. Good. I'm going to do about 20 of these. Again, try to bring the knee all the way back and then reset. Full extension, bring back, go back. Full extension, bring back, and then go back to neutral. Now, if it's easier for you just to do one leg and do that 30 times, that's fine, or you can alternate. Let's do about 10 more on each side, okay? So there's 1, 2, 2, and nice and controlled motions, just like this. You don't want to go super fast, okay? There's 3. There's 4, 5, 6, 7. You got 3 more. 8, 9, and 10. Alright, so getting that knee moving should probably feel pretty good, not as stiff probably as when we first started. The next exercise is a very functional exercise. It's sit-to-stands. You're using a lot of muscles when you sit to stand. You're using your glutes, your quads, your calves, your hamstrings. So you're using pretty much all those lower extremity muscles. If you can do it without pushing like this, beautiful. You can kind of have your hands across your body or just in front of you. Doesn't really matter. If you have to use arm rests to stand up, that's perfectly fine as well. If you're on a walker right now, I suggest you have your walker in front of you, a chair right behind you. So if you start to lose your balance, you can just sit down in the chair here. Now, very important when you get up from a chair, don't have your feet extended out like this, because that's just really hard to get up. You want to have it a little, not directly parallel with the floor. You want to have it a little bit back, but just make sure your knees aren't passing your toes, because that, when you stand up, that puts a lot of stress on the knees. We don't want that extra stress. So make sure your knees, when you stand up, don't pass your toes, okay? So standing up right here, and then you're going to use the quads and the glutes to stand straight up, okay? Also, if you have one knee that's a little bit more painful, don't be favoring the other side like this and not really using this side, okay? Try to use both knees and both legs equally, okay? So we're going to shoot for about 20 to 30. We'll start here, all right? Get the knees a little bit slightly behind you, and we're going to start standing. Ready? And go. Here's 1, 2. When you drop down, drop the butt down, come down nice and controlled, okay? Don't plop down, all right? So nice and controlled. There's 5, 6, 7, 8, 9. Don't snap those knees back. All nice and controlled. Very low stress. One more to do 10. 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. Let's do 5 more. 1, 2, 3, 4, and 5. All right, that should have worked up a little bit of a sweat. So you can have some water if you want. Go take a drink, take a little bit of a break. We'll come back, finish the stretching, and then we'll be done for the day. All right, I hope you got your refreshments. Now let's end the exercise with those same stretches, those first 3 stretches. So what I'm going to do is I'm going to kind of switch them around. I'm going to do this calf stretch first, so then we can just stay on the floor and finish the last 2. So again, find the wall. Have a nice sturdy surface here, so your foot's not going to slip. We're going to do the right leg first, 30 seconds. Feel the stretch, nice comfortable stretch again. Don't over torque it, just nice and comfortable. Alright, that's halfway. Try to keep that heel on the floor, don't have it raise up. 5, 4, 3, 2, 1. Switch. And then we'll hold this one for about 30 seconds. $15 more seconds. To get a better stretch, you can kind of just lean forward with your forearms, shift those hips forward, and there's a minute. We'll get on the floor here. We'll do the knee stretch. All right, start the timer here. Bring that knee as close to the butt as possible here. So we'll hold this one for a minute. One thing to mention is when you're coming out of the stretch, don't just come out like that. Come out nice and gentle, okay? We don't want you having any cramps or any stress on that joint when you come out of that extreme position really fast. All right, so 15 more seconds. Five, 4, 3, 2, 1. We'll switch sides. Halfway there. All right, 10 more seconds. 5, 4, 3, 2, 1. Come out nice and slow. All right, again, when you get up, roll to the side and get up that way, okay? All right, get that towel, make sure it's rolled up, put that knee on, And here we go. You can just start off with a little bit of overpressure just to get that stretch. Again, don't over torque it. You just want that extra, like maybe 2 to 5 pounds, just to kind of make sure you get that full range of motion and really stretch that hamstring area and even the calf area a little bit. Ideally, you have one hand in front of the kneecap and down, equal pressure. If your hands don't reach or you're not that flexible, you can just kind of work on the thigh here. Just don't push directly on the kneecap, push on the outsides, okay? There's 10 more seconds here. 5, 4, 3, 2, 1. And again, try to relax the muscles, don't tense up. If you find yourself tensing up too much, you might be pushing a little too hard. And so with that, just kind of back off a little bit. Alright, we have about 20 seconds left here. And if you need to have support, you can kind of have one hand support it, other hand pushing down. Ideally, you want to have it a little bit more at the heel there, just to get a better stretch here. Alright, and we are done. So come out of it nice and slow. So that's about a 20-25 minute exercise for the knees. If you do this every day up to your surgery, you should have better results. You should have better range of motion. You should be more familiar with the exercises that are to come right after surgery, and you should kind of get started right on your rehab after your total knee replacement. Thank you for watching, and until next time, thank you.